Hello and welcome, esteemed colleagues and MRCP aspirants. On behalf of PACES Preparation Pulse Academy, today's discussion centers on the investigative approach to Cushing syndrome and the strategies necessary to diagnose its underlying causes. Cushing syndrome is a multifaceted endocrine disorder caused by prolonged exposure to elevated cortisol levels. The possible etiologies include pseudo-Cushing syndrome, exogenous steroid use, ACTH-dependent mechanisms such as pituitary adenoma or ectopic ACTH-secreting tumors, and ACTH-independent mechanisms like adrenal adenoma, hyperplasia, or carcinomas. Pseudo-Cushing syndrome is often associated with reversible factors such as stress, excessive alcohol intake, depression, or simple obesity. Exogenous steroid use remains the most common cause of Cushing syndrome, frequently arising from long-term corticosteroid therapy for chronic conditions such as asthma, rheumatoid arthritis, or connective tissue diseases. Among endogenous causes, ACTH-dependent mechanisms include pituitary adenoma, Cushing's disease, and ectopic ACTH production, while ACTH-independent causes are often linked to adrenal pathologies. The investigation begins with a detailed clinical history and physical examination, focusing on potential steroid use and chronic medical conditions. To confirm hypercortisolism, at least 2 diagnostic tests are recommended: 24-hour urinary free cortisol, late-night salivary cortisol, or late-night serum cortisol. These tests help establish the presence of elevated cortisol levels. Following confirmation, a low-dose dexamethasone suppression test is performed to distinguish between Cushing syndrome and pseudo-Cushing's. Suppression of cortisol indicates pseudo-Cushing's, which is typically managed by addressing reversible causes like stress or alcohol use. If cortisol remains elevated, Cushing syndrome is diagnosed, and further evaluation is required. The next step involves measuring plasma ACTH levels to differentiate ACTH-dependent from ACTH-independent causes. Low ACTH levels suggest an adrenal origin, necessitating adrenal imaging such as CT or MRI. Elevated ACTH levels point to an ACTH-dependent cause, requiring differentiation between a pituitary tumor and ectopic ACTH secretion. A high-dose dexamethasone suppression test helps confirm the source. Suppression of cortisol indicates a pituitary tumor, while lack of suppression suggests ectopic ACTH production, prompting further imaging to identify tumors like bronchogenic carcinoma or carcinoid tumors. In conclusion, diagnosing Cushing syndrome requires a structured, stepwise approach to identify its cause and ensure appropriate management. Patient education and multidisciplinary collaboration play pivotal roles in optimizing outcomes for this challenging condition. For more detailed explanations and related topics, we invite you to watch our videos on our YouTube channel. Don't forget to like, comment, and subscribe to stay updated with our latest educational content. Thank you.